nurse for 40 years, and I've never seen it like this. It's one thing to have beds, licensed beds available, but it's a whole nother thing to have enough people to staff them.
A staffing crisis at hospitals here in the Valley and around the state. That was a top executive at a major Arizona healthcare network warning that there aren't enough people to care for the patients filling their beds. Almost 2 years into the pandemic, there are thousands of vacant healthcare jobs, and it could get worse as the holidays near. Joining us now to dig deeper into that staffing crisis and the other leading COVID-19 indicators is Will Humble, Executive Director of the Arizona Public Health Association and a former Arizona Public Health Director himself. Welcome back to Square Off.
Thanks, Brown.
So tell us, is this staffing crisis preventing hospitals from providing care?
In certain parts of the states, that's absolutely true, especially the rural parts of Arizona. And one of the reasons for that is the rural hospitals, what we call critical access hospitals, aren't usually part of a big chain like Banner or Abrazo or Honor Health, for example. And so when they have patients that they need to transfer to another level of care, they have to rely on other partners to do that. Whereas a place like Banner has the ability to move patients around the system. So the flexibility that the bigger hospitals have are helping them. But the really critical issues are in those rural hospitals.
Are the bigger hospital chains like Banner immune from this?
No, they're not immune from it either. They're having staffing issues themselves. It's just that they've got a corporate headquarters that can help them move patients around through a system. And the rural hospitals don't have that kind of system. They have been relying on what's called the surge line from the state health department. That allows a small hospital to move patients to a higher level of care. And they've been using that throughout this pandemic. And what the rural hospitals would like to do is to be able to move non-COVID patients through the surge line. But so far, at least, the state health department has been unwilling to help those rural hospitals in that way.
So how much of this is related to the pandemic's ongoing stress?
Well, it's all part of that. I mean, if it hadn't been for this Delta wave, we wouldn't be doing the show right now, quite honestly, because there wouldn't be a shortage. The issue is that about right now, 32% of Arizona's ICU beds are taken up by COVID-19 patients. And there has never been 30% headspace in the hospital system in Arizona, not even in a normal June without a pandemic. So hospitals across the state are trying to accommodate this huge influx of COVID-19 patients in ICU and general ward floors, and there just isn't the headspace for it staffing wise. Another issue, honestly, is that a lot of nurses are burned out. This is the third big wave that they've had to deal with. They've been running extra shifts. They're understaffed. They're stressed out. And they know, honestly, they know that they could take a sort of a mental health break for 6 months and come back. And they know they could find a job within 2 or 3 days of trying to come back into the system. So we have nurses that are deciding to take a break, not quit their career, but take a break for a while, and that's putting stress in the system. And there's one thing that no one is saying publicly, but is definitely part of this, which is patient behavior has been a problem. And it doesn't take too many belligerent patients to wear down the nurses. You know, most patients are really respectful, they're thankful, and the family members. But there are patients out there that are unwilling to wear masks as required, that are even telling nurses they don't believe that their loved one even has COVID-19 because it's not real. So it doesn't take very many of those to wear down nurses, and that's part of what's happening too.
And at the same time, the hospital systems have some deadlines coming up for their workers to get vaccinated. Could there be an exodus of more healthcare workers who don't want to get the vaccine?
We don't know the answer to that question yet. For sure, there will be nurses that decide to leave rather than get vaccinated. Most of the big hospital chains have put a November 1st deadline for their staff to at least get started vaccinating. And there are, some nurses that say they won't do it. Remains to be seen what the percentages actually are. I have been told anecdotally that many of the rural hospitals have not put that requirement in place because number one, they have such a shortage of staff as it is, and they can't even afford to lose 2 or 3 nurses in a hospital that's in a rural area. So many at least of the rural hospitals have not put that vaccine requirement in place.
And let's look at other COVID indicators. The governor said 10 months ago, vaccinations were the way out of this pandemic. And 10 months later, the state is only at 51% fully vaccinated.
Yeah, it's super disappointing.
How do you move that needle? It's been stuck there.
Yeah, that's super disappointing. And the governor was right. That was the pathway out. But because the vaccine has nationally become a politicized issue, and there's national network commentators that have been driving down the enthusiasm for getting vaccinated, and that's taking a real toll on getting the public vaccinated. There's this huge discrepancy between registered Republicans, and we did a survey. 92% of likely voters who are registered as Democrats in Arizona are vaccinated, and only 52% are Republicans. And so there's this political divide that's really putting a damper on getting enough people vaccinated to get to herd immunity. And then so what's happening is we're just infecting our way to herd immunity. That's just the truth.
And the caseload seems to suggest that cases were declining, but the curve seems to have flattened at about 2,500 cases a day, 3 times the spring level. Is that what's going on? Just an inability to stem infections?
Yeah, that's it. I mean, well, part of it, Delta is just so infectious. And if you compare the epi curve, if you will, from the winter, when it started going down, it kept going down. And what we're seeing with this Delta surge is that it started coming down. The number of cases per day started coming down about 3 weeks ago. And instead of keep going down, it flattened out. And now we're stabilized at 2,500 cases per day, which is not enough to really provide the kind of relief that we need in the hospitals, given the capacity limits that they have because of staffing.
So here we are, end of the year, final 3 months, holidays coming up, lots of people getting together, going to events. We're not as vaccinated as we should be. Cases may be flattening. I'll make this a personal question. What's your routine going to be like in the coming 3 months as you put all this information together and decide how you want to behave?
Yeah, well, all of my family members are fully vaccinated. My parents are pushing 90, and they're both fully vaccinated, but they've only had 2 doses of Pfizer. So my goal is to get them that 3rd dose. But once I get my parents that 3rd dose, we're going to wear masks in public, especially when we're indoors. And I'm not going to change our routines much. We're fully vaccinated. We're going to wear masks in public to be courteous of others, especially when we're indoors. But because our family's fully vaccinated, I don't see that my lifestyle or our lifestyle needs to be really crimped too much. And I don't really mind wearing a mask. The people's behavior that needs to change are those people that are unvaccinated or that have unvaccinated family members that are going to be coming to Thanksgiving parties and stuff. And for them, the real key is try to talk them into getting vaccinated. I don't know how well that's going to work, but at least get some rapid test, antigen tests, and make sure that people get tested before they come over for a family gathering or something.
All right. Will Humble, thank you so much for joining us and for your insight. Take care.
My pleasure. Thanks.